right, everyone. I'm Dr. Neil Jolly, and I have one of our patients, Miss Karen, who actually was experiencing long COVID symptoms for quite some time. And I wanted to share this story, particularly because there are a lot of other patients out there that are probably like Miss Karen. But I just want to start off by asking you, Karen, tell us your story, sort of how you came to me and what you were experiencing before you came to me.
Well, I had gotten COVID back in July of 2020. I lost my taste and smell, and I was kind of at my wit's end when I came to you. I had developed over time a chemical taste and a chemical smell, and I couldn't eat meat. I was down to eating just bread and water, and I just needed to survive, basically. But yeah, I couldn't eat or smell anything. It was normal anymore. And I went in a year and a half of this.
Wow.
So my primary care doctor said, I might know a guy.
That's great. And so that's exactly what happened. You know, I got the phone call and we did our own research internally. We heard about some patients out in Texas and elsewhere that were getting a procedure that we perform as pain physicians. It's called the Stellate Ganglion block. We offer that to you. We had the procedure done. I'll explain that for everyone else out there in a minute, but just tell us about your experience with that procedure here briefly, and then let's talk about what you felt on the back end and what you experienced.
Sure. You explained to me everything in detail, and I thought, what have I got to lose? I mean, you explained it's just a shot, you know,
Yep.
kind of to reset everything. So I came in, and yeah, and it was painless, it was quick, and I had results right away.
That's great. Yeah, and just tell us about those results on the back end, because that's really what we want to hear and why we're here today. Explain sort of what you experienced literally that evening.
Well, meat smelled rancid to me, horrible. I couldn't eat meat. So I told my husband that night to cook steaks to see what would happen. And immediately I didn't have the rancid smell, and I thought, oh my goodness, it's working. And,
Awesome.
and so I ate a steak that night, and it was wonderful.
That is great.
Couldn't believe it.
And now we're several weeks out,
Yeah.
and it seems like we're holding up just
Yeah.
fine. That's in line with the research, what that's shown too with this stellate ganglion block, that patients do experience relief of these symptoms for quite some time, sometimes several months and even longer. Now, we'll just briefly explain the procedure for everyone else that may be interested in this. It's called the stellate ganglion block. It actually was, and I think I told you this, but if I didn't, it started over 100 years ago. It was like in the 1920s when this procedure first came out. And the idea behind the procedure is it's just a simple injection of local anesthetic numbing medication to block the sympathetic nervous system. So it essentially resets the entire system, and that system controls various aspects of the body. Now, it initially was done for what we call CRPS, it's nerve pain, but then we started to develop other angles to treat PTSD, post-traumatic stress disorder, with the stellate ganglion block. And now, finally, there's been a link between long COVID symptoms and the sympathetic nervous system. So basically, to sum here, Ms. Karen actually is probably our first, most likely our first patient in New Orleans that actually received relief with the stellate ganglion block. And while it's being performed across the U.S., we're really excited that we're able to offer that to you. We're hoping we can offer it to more patients in the future. So I'm pumped, I'm excited. I'm so thankful you shared your story, Karen.
Look, I'm excited.
Yeah, that's great.
Yes, and I thank you so much for it.
Anytime. Thank you so much, Karen. Take care.